Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balata from Roots Community Health Center, reporting for the week of August 15th, 2022. Today, I'm going to give a COVID update, including the new CDC Guidance overview, and I will also give an update on MPX, otherwise known as Monkeypox. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Here in Alameda County, we see that the 14-day total cases is coming down nicely. Last week when I reported, we were at 7,974. We're now at 6,780. So we see that we're finally having kind of a sustained decline in the number of cases, which is good news. And when we look at the percent positivity, it was at 12.9 when I reported last week. We're now down about a percentage point. So we know that these are not perfect metrics because we have so much home testing going on, but I still do think that looking at trends is very important. And certainly this is a trend now that we've seen sustained for a couple of weeks. So that is overall good news. Of course, we're going to want to see it come down quite a bit more in terms of cases, positivity rates, et cetera, particularly as we prepare for and before we head into fall and winter, a likely winter surge. We're finally, I think, seeing a decrease in hospitalizations. It's been the zigzagging thing going on for quite some time now. But last week when I reported, we were at 161 in the hospital, 23 of those being in the ICU. And we're now down to 149 in the hospital and 17 of those in the ICU. Obviously, this is still too many, especially given the fact that we now have a very effective treatment. So I certainly do wonder if the treatments got to these folks in time, the folks that have made it to the hospital. So we're going to continue to try to learn more about who is still having poor outcomes from SARS-CoV-2, but hopefully we'll continue to see a sustained decline on this metric. Unfortunately, when we look at deaths, we are still looking at about 450 to 500 deaths per day in the United States. This is quite a high death toll. And so this is something that we really do need to see come down before we decide that we're just going to have the tools and let every person fend for themselves. This is still a pretty unacceptable state to be in. We're talking about that would equate to about 160,000 to 180,000 deaths per year from a communicable respiratory illness. So this strikes me as something that is not acceptable. By way of comparison, we lose about 40,000 people per year to auto accidents. And we're always implementing new ways to prevent automobile deaths, from seat belts to car seats to assisted driver technology, speed limits, speed bumps, all of the things. We can always do more. But those are considerable investments that we make as a country because we don't like the fact that we still lose 40,000 people per year to something that should be preventable. So it's unclear to me why we would think that 160,000 to 180,000, and that's if deaths stay where they are now and don't go up in winter, which we have no reason to believe that that will be the case. But I would say a best case scenario, we're talking about 150 to 180,000 deaths per year. We have a ways to go in terms of investing in infrastructure that will protect our community and our population from such a high death toll. I just simply do not believe that any of us should be settled with this many deaths, 450 to 500 deaths per day. So we will continue to keep an eye on that and continue to advocate that we need to be implementing as many mitigation measures as possible. And I'm going to talk a little bit more about what that means in light of the CDC's new guidance. As it relates to our variants, last week when I reported, we were at about 86% of the BA5, and I mentioned then that the BA 4.6 is more contagious and was at 4% at that time. So now the BA 4.6 is at 5%, and BA5 is at 80%. The BA 4.6, which is in the dark blue there, is kind of slowly displacing the BA5. We'll see if that continues. For whatever reason, in the Midwest region, BA 4.6 is at 13%. So not sure what that's about, but it does appear that BA 4.6 is more contagious. It remains to be seen whether it will take over entirely. And we're also kind of waiting for more information about how the vaccines and everything else is holding up against the BA 4.6. So we'll just continue to keep an eye on that. And I'm going to once again report on this metric, which really I think is the picture just is worth 1,000 words here. This red line is folks who are unvaccinated, and this is showing deaths. And so you see 11.2 times more likely to have died than those who are boosted. And so just really, I think, underscoring what we already know, that folks who are unvaccinated are really the ones at greatest risk of a poor outcome, particularly death, but not the only ones. We still see people are unfortunately still dying, even though they're vaccinated and boosted. And in general, this tends to be our elders and folks with underlying conditions. However, we really do need more information. As I alluded to earlier, we need to know, did folks receive treatment? Because we know that that is making a big difference with treatments reducing the risk of death by about 80%. So there's just no reason for anyone else to die from this. And I think we still have a ways to go, obviously, in order to close some of these gaps. And so many of you, I'm sure, have heard about the CDC kind of coming out with these new guidelines. I'm not going to post them here for a reason, because I think what they essentially do is they kind of remove most of the kind of requirements, and they leave things up to individuals and to counties and to states. And this, I think, has been a point of confusion all the way through the pandemic. I've spoken on it many times, that the CDC, for lack of a better way of putting it, kind of sets the floor. And so you can't do less than what the CDC says. However, when they recommend things or strongly recommend things, then they sort of leave it open to the counties or the states to do more. And there have been many instances where the state of California has done more, where Alameda County and the other Bay Area counties have done more. However, unfortunately, it doesn't really provide the type of support that I think is needed and would be important for all states and counties and school districts and so on to be comfortable really requiring more. And so unfortunately, a lot of these other jurisdictions are sort of meeting the floor that is being set by the CDC. And I just find this to be a very unfortunate situation because, I think previously we really thought of the CDC as the standard bearer and the ones that would tell us really what we needed to do and what the guidance needed to be in order to protect ourselves, particularly when we are experiencing such a high death toll and continuing to have 40 to 50,000 people in the hospital per day with COVID, 450 to 500 people dying per day. So this isn't the time to lower the standard. However, unfortunately, what has happened is that there's no longer sort of requirements around quarantine. They're very loose. It's about wearing masks without specifying what type of mask. There's no requirements around testing to get out of isolation or to return to school. I find this very concerning. We know that there's a lot of mixing that happens in classrooms, and it's leaving the masking kind of up to localities to basically decide whether they want to impose masking or not. And I think for a lot of school districts and counties and so on, it becomes difficult to sort of mandate and require these things. So what everyone ends up saying is masks are strongly recommended, especially when there's high community transmission. But somehow that is leading to what I'm sure a lot of you have noticed, which is that in a lot of places, there just is not consistent masking. And so what does this mean? So what this means is that if you are someone who would like to continue to protect yourself from catching SARS-CoV-2, whether it's for the first time or the second or the third or the fourth, because remember, there is no limit that we know of how many times you can catch this. And every time you catch it is another opportunity for a bad outcome. It's also another opportunity for long COVID. And there's still so much we do not know about long COVID, about the post-COVID impacts. I'm going to talk more about post-COVID and long COVID next week, barring any other new developments. But today I felt like it was important to talk about the CDC lowering what was already fairly loose standards, in my opinion, because this is happening at a time when school's back in session. And the message that seems to be getting out is that we don't need to take any precautions anymore, which is absolutely not the right message. But what I think is being said loud and clear is it's up to each and every one of us to do what we feel that we need to do to protect ourselves, because we cannot rely on anybody else to do it. And so many places are becoming less safe. And that means that if you're someone who wants to keep yourself from catching SARS-CoV-2 or catching it or spreading it or catching it again, then that means you have to step up what it is that you are doing. And I think we all have to step up, not only what we're doing, but also the amount of education and understanding that we all really have. And so, of course, the role of the People's Health Briefing has been to bring education directly to the people. Now, I think we need to also think about how are we bringing this information into the schools? Are we teaching children? We teach children about smoking. We teach children about seat belts. We teach about all kinds of different public health items. And so I think we teach them how to wash their hands. We teach them to cough into their elbow so that they don't spread germs. We're in the middle of a respiratory pandemic. And I think now's the time to teach the children in school about how you catch SARS-CoV-2, about filtration masks and what their role is in an airborne pandemic, that we provide them for free, and that if they so choose to wear them, that they do, because they may want to protect themselves or those in their homes or one another. I don't know why this would be anything controversial. Unfortunately, this whole situation has gotten very politicized, and that's very frustrating. But I think that facts are facts, and we should all be sort of operating with the same set of facts, which is that there is abundance of evidence around the effectiveness of masks, not only at the individual level, but also at the population level. And unfortunately, we are no longer able to rely on masks at the population level unless communities decide, take it upon themselves to go ahead and mask. And so certainly if you are a venue owner, a business owner, there's nothing to stop you from requiring masks of your staff, requiring masks of your patrons, or suggesting them, or putting signs in common areas to say, please mask, in the restroom, in the common areas, which tend to be the places where transmission is more likely to occur, and providing high quality masks. So at this point, we need to really make a big distinction between the types of masks, because if you're the only one masking, your mask needs to be a whole lot better than if everyone was masking. So these are the unfortunate facts that we really do need to take matters into our own hands about not only being vaccinated and boosted, but also to step up the quality of our masks. And the other part that's a little unfortunate is that we're really just sort of leaving it up to individuals and parents and so on to decide when to test. And so testing will no longer be as widely available within the schools as it was. We've already seen many testing sites closing down. Roots continues to provide community testing. And you can go to our website, rootsclinic.org, free community testing. We are still offering PCR testing, which is the very sensitive kind of gold standard that if you really need to get it right, you're early on, you think you got exposed, you need to know, you take care of someone who's vulnerable, etc. But really, if you think you have it, wearing a high filtration mask like a N95, a KN95, or a KF94 is going to be the way to go. I'm going to talk a little bit more about that in just a moment. But I think we also need to be sharing information more about what we don't know about the impact of repeat infections, about the impact of long COVID. And I think we need to be taking this information directly to all individuals of all ages, because everybody deserves to know. And I have definitely seen that in some of our work with young people, they are choosing to mask. With information, armed with information, they are making that decision on their own. And I think because young people in particular are supposed to have decades of good quality life ahead of them, they deserve to know how to best protect themselves. And so that is good. That is one of my pleas. As school's back in session, we need to update the curriculum. We need to update the health curriculum. We're going to go beyond just coughing in your elbow and washing your hands. Those are great. Those are important, but guess what? We're in the middle of an airborne pandemic that continues to claim the lives of 500 people per day. We've already made orphans out of over 200,000 American children. And so I think we need to really not put our head in the sand at this point, which is unfortunately somehow what the CDC's dropping of some of the guidelines has seemed to allow some folks to feel like we're done, we're gonna take off the masks. And I am seeing many events and things that really have the making of super spreader events. We know of many super spreader events, conferences and so on. Don't throw a super spreader event. And if you're attending an event that you think could become a super spreader, then really think about protecting yourself with a high quality filtration mask that fits you well. The other thing is that, we're hearing from a lot of families with children who they are worried that because of underlying conditions, they are no longer safe at school. And this is very understandable concern. So I just want to point out that Title II of the Americans with Disabilities Act, Section 504 of the Rehabilitation Act, these protect the rights of individuals with disabilities to have equal access to public facilities and institutions. So what does that mean? And I put the link for this in the post in case this is something that you need to reference. What does that mean? This means that students with disabilities have the right to access schools without putting themselves at risk of hospitalization or death. And so what that means is that the school may decide, okay, well, in order for these students to be able to access school safely, that means that all students need to mask. Once again, how this became political and contentious, I just think this is one of the things that history is just not going to look kindly upon as we retell this really a horrific story, in my opinion. But yet here we are. And so it will take a lot of courageousness for something like that to happen, or perhaps a lot of advocacy on the parts of parents. I would like to take another opportunity to applaud BART, Bay Area Rapid Transit, who did keep the masks in place, mask requirements in place. And we would really like to see others do this, because public transportation, public spaces, this includes schools, now may hold undue risk to those who are disabled, and that is not acceptable. It is ableist. It is shutting out parts of our society from being able to enjoy public spaces that they have a right to. And so those who are in charge should be accountable for ensuring safety, just like I see as part of my role over a health center, and many other business owners see as their role being over their businesses and their staff and wanting to keep everyone safe. So yes, sometimes it's hard, but we are in the middle of a pandemic that continues to claim too many lives. And so school boards, transit boards, and others who are stewards of these spaces, we need to ask them the tough questions. Is this space safe for me? Is this safe for my child who may be disabled? We need to sort of demand those kind of protections. And so that link is in the post, something to take a look at and think about. And so what about masks? Well, as I said, I think it might be time to just throw away the surgical masks. Probably time to toss the cloth masks. It's time to really step it up. If you are serious about not catching SARS-CoV-2, then at a minimum, a KN95. Also, N95s are excellent, and KF94s are also a good choice. So the KN95 are the ones with the ear loops. They make them in black and all kinds of different colors. And sometimes, you need to check for different sizes because they are ear loop and they don't go around the head. So they're not going to give quite a snug of a fit, but you can get a pretty decent fit for KN95s. And this is what I opt for if I'm going to be in close proximity with anyone outdoors, or if I'm just going to be a short time kind of in and out of somewhere. I feel like I have a really good fit. It took me a few tries to find a brand that I liked. I've recommended here before Project N95.org because they have vetted all of the different masks. And so that is a good resource to try to find different sizes, especially if you need to shop for folks with bigger faces, little faces, kids, and so forth. Time to step up the mask game, and at a minimum, a KN95. This is an N95. This is one of my favorites, called the Aura mask. And this is the one that goes around the head. So if I know I'm going to be in a higher risk environment with a lot of people, a lot of folks in the public, if I need to be in that space for more than an hour, I'm going to be opting for this one, an N95 with the straps that go behind the head. And this one happens to fit very well. And because it kind of pouches out here like this, it's actually quite comfortable. It stays away from the mouth. And it is actually very, very comfortable. So now I'm going to turn to monkeypox, or MPX, which I will do my best to call it from here on out. We know that we have got a state of emergency declared by the United States government, also by California, and a public health emergency of international concern declared by the World Health Organization. We have got currently 31,799 confirmed cases worldwide. In the United States, we jumped up dramatically since I reported last week. We're at 11,177 cases. In California, we've got 1,945. Alameda County is third in terms of number of cases in the state of California, behind Los Angeles and San Francisco counties. And we're at 112 confirmed cases. I will say that the confirmation process is taking a while. And so these numbers are definitely underreporting at this time. It's taking several days, and they're wanting to oftentimes reconfirm just to make sure. We're unfortunately also hearing of too many people presenting for testing who are not being tested and who are being given an alternative diagnosis that may later turn out to be incorrect. We've unfortunately already have experienced that. And so I would just encourage a lot of diligence. Unfortunately, also advocacy is required in order to get tested. If you think this is what you have, if you think maybe you've been exposed, if you think you have risk factors, but you may not know you have risk factors, you may not have risk factors, you may have just somehow come into contact with this virus. And so I think we are going to have to really move away from this notion that only certain people can catch MPX, because that is definitely not the case. And we're seeing the population that's impacted shift over time, and we anticipate continuing to see that shift over time. And we can see here the map of the cases in the United States, again, over 11,000 cases. And you can see in the dark blue, California being one of the states that is most impacted. And so what we know about MPX at this time, it is spread by close skin-to-skin contact with someone who has MPX. It is spread by touching contaminated items, particularly porous items, clothing, linens, towels. Also respiratory droplets, in prolonged face-to-face contact. Now, if you got any one of these, then that's going to protect you from MPX. If it protects you from SARS-CoV-2, it will protect you from MPX. MPX is not contagious in the same manner that SARS-CoV-2 is. Now, so that's kind of the way it's better than SARS-CoV-2 is that, or less worrisome, is that it's not aerosol or airborne type of transmission that we know of at this time. It appears to be that you would really have to have prolonged face-to-face contact without wearing a mask in order to catch MPX in that way. So if you're protecting yourself from SARS-CoV-2, then you will be protected from the droplet spread from MPX. It's really the close skin-to-skin contact or something that someone who has MPX was in close contact with that gets contaminated. And unfortunately, and this is where it's more worrisome than SARS-CoV-2, is that it does live on these surfaces for quite a long time. So if you are someone who is required to handle soiled laundry, like housekeeping or in a gym or at a school or in the dorms or in hospitality or in prison, you need full PPE. Your employer needs to provide you with a filtration mask and also gloves and potentially a gown and face shield, depending on what we're talking about. If you work housekeeping in a hospital, and you may have patients that have MPX, absolutely full PPE to handle the soiled laundry. So that is something we really need to continue to advocate for: improved workplace protections for not only SARS-CoV-2, but also for MPX, particularly in handling these soiled items that could be contaminated. And so we know that at a minimum, a person with MPX is going to be contagious from the time the rash appears until all the lesions have crusted over and the scabs have fallen off and the new layer of skin has formed. That's at a minimum. Is the person contagious for longer than that? Well, that's very possible. We don't know the details yet. So what we don't know is we don't really know the entire duration of how long a person remains infectious with MPX. So anyone who catches MPX, we really do want to wear a mask if they are going to be in public after they know that they have it. How long? So there's been, the CDC has even said that the infectious period could be 4 to 6 weeks. We really don't know. There's still a lot we need to learn about this, but definitely when the rash is still present, that is when we know for sure that you're contagious. And so at that point, we're going to want to avoid any close contact. And we also don't know if the infectious period is different or if things are more severe with different types of transmission, like if you caught it from handling the laundry, is that any different than if you caught it with close skin-to-skin contact or so on? This probably has to do with how much of the virus you received during that contact. And once again, we just have a lot to learn from this. We also don't know whether there's asymptomatic spread or pre-symptomatic spread of MPX. So again, a lot to learn. But I think the bottom line here is if you have symptoms or you think you are exposed, please get tested as soon as possible. You're going to want to know if you need treatment. We're going to want to get your contacts vaccinated, and we're going to want to be ready to support with pain management, because that is really the primary thing we're seeing is really excruciating pain that needs to be managed with pretty heavy duty stuff. And most of the people that are being hospitalized right now with MPX is actually for pain control. That means it's pretty severe pain if we can't control it with oral medications. And the vaccine is becoming more available. And so if you are close contact of someone who's confirmed, or if you believe that you're at high risk, it is becoming more and more available. So I put the link in the post for Alameda County of where to obtain it. That's going to continue to be getting updated all the time. And I really do think that this is one area where what we just went through with COVID in terms of having to set up new sites that can do testing and can do vaccination and so forth, and really being in close collaboration with the public health department. All of those things are, I think, helping us respond a little more quickly in this particular crisis of MPX. And so hopefully we will fare better. But right now, unfortunately, we're in a situation where the trajectory of cases is going pretty steeply up. And that's even with limited testing and with sort of us just getting started, and with a lot of people, not being able to get access to tests. But we have had children be infected. We have had many segments of the population. Really, there's no segment of the population at this time in terms of age, in terms of sexual orientation, in terms of race. There's no sector of the population that hasn't already been touched. And that's even with us not providing broad-based testing. So once again, there is nothing about MPX that is going to target any one particular population. Where we need to be the most concerned is for young children and pregnant women, where the outcomes can be more severe. And this is what we do not want to see. And so we're going to just continue to practice vigilance. And so just in closing, we're going to continue to do these best practices, really, which are going to prevent transmission of a lot of things, even the flu included. Before we head into flu season shortly here, we're going to continue to mask. We're going to step up our mask game. We are going to pay attention to ventilation and filtration in indoor spaces. That might even mean investing in a CO2 monitor to see how the air exchange is in your area. We're going to continue to distance. If you can't distance and you're outdoors, then go ahead and pop a mask on your face. We can still transmit even outdoors. And of course, hand hygiene is important for preventing the spread of all contagious diseases. And we're going to also want to add to this that if you are someone who is handling soiled materials, then we are going to want to wear gloves to prevent MPX. And as it relates to COVID, if you catch COVID, we want you to know what it is you're going to do ahead of time. And so you need a testing and a treatment plan. If you catch it, what are you going to do? Are you someone who should take Paxlovid? And so we're going to want you to really have a primary care doctor. If you don't have one, please get one. You need a treatment plan ahead of time. And in general, we want to remember, just take good care of yourself. Eat a balanced diet, get some activity. Weather's beautiful out there. Get outdoors, get some fresh air, get some natural vitamin D. At least think about taking a multivitamin. Maybe you need some additional vitamin D supplementation. Ask your doctor to check when they draw your blood. You need to know your cholesterol, your sugar, your vitamin D levels. Manage your stress, get a good night's sleep. If you have any questions, please put them in the chat, send them by direct message, or email us at admin@rootsclinic.org. This concludes today's People's Health Briefing. Thank you for joining us. We'll see you again next Tuesday at 10 a.m. See you then.